evening, everyone. संसाधन कम थे पर सपने बड़े थे, रास्ते कठिन थे पर हौसले खड़े थे, दौर बदले, तकनीक बदली, जमाना आगे बढ़ा, पर सीखते रहने का जज्बा आज भी उतना ही रहा. Ladies and gentlemen, today we are just not introducing the speaker, we are celebrating his love story. A love story with interventional radiology. A love that began 40 years back. A love that was deep, passionate, and for many years it was completely one-sided. Long before interventional radiology became fashionable, before Cath-Labs multiplied, IR became a hot specialty. Dr. Shrikaant Kothekar was already romancing with IR, almost alone in central India. While others were still asking, can we treat this disease without surgery, he was already geared up with his needles to treat such diseases. He introduced interventional radiology when resources were scarce, infrastructure was minimal, and believers were very little. Yet he stood firm, nurturing IR with courage, conviction, and stubborn belief that yes, image-guided therapy is the future. For many years, his love for IR was truly one-sided, no glamour, no applause, no large teams, just dedication, late nights, difficult cases, and unwavering commitment towards the patient. And today, IR enjoys the spotlight, multiple subspecialties, and packed conferences hall. We are all privileged to hear from someone who has lived the entire journey from scarcity to sophistication and from skepticism to acceptance. Many often say that what is there in the soil of Nagpur? Why did so many people get attracted towards IR? But the answer is simple. Some people have that charisma to make the field of IR look beautiful. And yes, Dr. Kothekar is one amongst them. Not only he performed the pioneering procedures, but also sensitized both medico and non-medico communities on every platforms and also the social media, and is greatly seen on Facebook. His passion and enthusiasm have inspired many of us to walk towards IR with curiosity, confidence, and pride. For more than around 4 decades, he has shared his journey not only with interventional radiology, but also with Dr. Rupal Kothekar, a renowned OBGY surgeon at Nagpur. And his partnership is marked by balance, strength, and mutual excellence. And now, ladies and gentlemen, please join with me to welcome Dr. Shrikaant Kothekar, a pioneer, a mentor, and a passionate interventional radiologist, for his oration over here. Thank you.
Thank you, Rajesh, for this passionate, lovely introduction. I'm a little... Anyway, let me start. Good evening, esteemed ISVIR President and Secretary, distinguished faculty, colleagues, and future architects of interventional radiology. I stand here today with a profound sense of honor and humility to deliver ISVIR National Oration. My deepest thanks for the privilege. Tonight, we journey to the geographic and spiritual heart of our country, Central India, Nagpur. This is not just a medical history lesson, this is a love story, a 40-year of romance built on courage, resilience, and a relentless pursuit of perfection and catheter. It is a story of how Central India went from being a referral origin point to a destination of medical excellence. Government Medical College, Nagpur, is not just an institution. It is a landmark of medical heritage in Central India. It is one of the largest and most prestigious teaching medical campuses in Asia. it has always been very vibrant. Every journey needs a first footprint. In central India, that footprint belonged firmly to the pioneers who dared to dream of world-class facilities right here. A cohesive department at that time, supporting each other and celebrating small successes. The OGs of IR, these OGs of IR battled bureaucracy, infrastructural deficiencies, and a deep-seated lack of awareness. They began with a scratch, teaching themselves new techniques, using basic setup of image intensifier to perform nephrostomies, biliary drainages, and direct puncture carotid angiograms. Let us begin our journey at the point of origin. I joined the Department of Radiology and became a member of OGs of IR in February 1985, along with Dr. Rupal Mashruwala. This was her first house job. My first house job in anesthesia involved emergency and difficult ward intubations. This gave me confidence during my radiology house job, knowing I could intubate, ventilate with an ambu bag, and shift patient to the ICU if required, and won't allow patient to die in department. I became proficient in gynosil bronchography with a red rubber urethral catheter in awake patient using Mangel's forceps. This experience enabled me to assist others in non-vascular interventional procedures such as nephrostomies and biliary drainages. On 20th April 1985, I got my first opportunity to perform a direct puncture carotid angiogram. As my co-house officer Rupal was less interested in angiography and inclined towards OBGY, I began performing angiogram for her unit as well. So got hooked to the arterial spurt of blood and in turn to impress Rupal. From co-house officer to friend to girlfriend and to my wife on 29 June 1986, this happened very quickly. And romance with IR started. Since last 40 years, I am trying to impress her. This time, during the 85, all the thesis topic used to be on intervention, nephrostomy, biliary drainage, hypernephroma embolization, and renovascular evaluation by angiogram. My thesis topic was on paravertebral plexus venography for evaluation of disc lesions. After 2-3 months of all attempts, due to lack of suitable catheters, guide wires, it was abandoned. You can go through this later. I was awarded rupees 11 for excellent tomographic AVC-gram. That meant a lot to me that time. There were 8 lecturer posts in the department, and all of a sudden, all my seniors started leaving the department to learn the ultrasound. And I was left alone to do all non-vascular therapeutic interventions. In 1988, a major milestone was achieved with the installation of area's first Cath-Lab at Central India Institute of Medical Sciences. During transfemoral 4-vessel DSA procedures, difficulty in cannulating left carotid often led Dr. G.M. Towry, director of CIMS, to call me to complete the study with the permission from Dr. B.S. Chaubey. He was dean that time, dean of GMC Nagpur, and I was full-time lecturer in the department. For the first time, I saw 7 French introducer sheath and 6 French Judkin catheter. There were no headhunters, and I am using Judkin for all 4-vessel DSA. 87 to 90 was a period of uncertainty as I was locum lecturer at GMC. I joined CIMS on 1st October 1990 with a salary of rupees 5,160, while my wife, a class 1 gynecologist at Ordnance Factory Hospital, Nagpur, earned rupees 12,800. Our household ran smoothly despite my not learning ultrasonography. Beautiful setup of analog Cath-Lab. You can see puck changer, Odilka camera, and it was really very interesting to develop a film, that too in dark room that time. A true turning point in any IR program is the shift from diagnosis to therapy. In central India, this began with non-vascular intervention such as nephrostomy, biliary drainage in 86, offering vital surgical alternatives. The defining leap came in April 1992 with the region's first renal angioplasty. This was small in scale but transformative in impact, marking the moment IR was truly born in Nagpur. This was soon followed by complex life-saving procedures that shaped the new specialty in the region. In 93, the first uterine artery embolization using diagnostic catheter and gel foam was performed for post-LACS PPH, saving lives and uteri and highlighting IR's vital role in OBGY. The work was later presented by gynecologists at World Congress of OBGY in Montreal. Post-evacuation torrential bleeding PV received 14 transfusions while in transit, embolized using diagnostic catheter and gel foam only. Dr. P.S. Bidwai, a distinguished cardiology pioneer, former HOD, PGI Chandigarh and SGPGI Lucknow, he was working at CIMS. I benefited from him immensely as I used to assist him during his coronary and non-coronary interventions. You can see I attended the first World Congress of Interventional Cardiology also. In his presence, I used to do coronary angio. This helped me in keeping away cardiologists from doing peripheral vascular work, as I used to do coronary angiography for free. Interventional radiology does wonders. No surgery is required to save your limbs, brain, and life. This was the tagline used to make IR procedure popularized among the masses. I always had an independent clinic, 1 hour in morning and 1 hour in evening for new and follow-up patient. Got appreciation and recognition from none other than Dr. Ravi Ramakantan in 1994. This boosted my confidence to do better work. A major complication occurred the following year during bronchial artery embolization for massive hemoptysis in a young patient. Although the bleeding was controlled, a 4 French royal flush catheter with a guide wire got stuck in the right bronchial artery and could not be retrieved. Attempts caused severe pain, and amid pressure from large crowd, the catheter was left in situ and the patient was shifted to KEM. Dr. Ravi sir also attempted retrieval and concurred that it should be left alone, after which the relatives were calm and counseled. News atom for FTR came in March 97. The first Cath-Lab with DSA and roadmap was installed at Super Specialty Hospital. I was appointed honorary professor there. The first carotid stenting in the region was performed on 4th October 1998, marking a high-stake neurovascular milestone and firmly establishing IR in the treatment of stroke and complex neurovascular disease. It signals Central India's readiness for state-of-art endovascular care. The patient belonged to CIMS under Dr. G.M. Tawri, who graciously acknowledged the procedure in the annual report of CIMS despite it being performed at another hospital. Spandan Heart Institute installed Philips Cath-Lab in February 99. So all the cardiology work generating from there about peripheral work that I used to do there. CIMS Cath-Lab got digitalized and upgraded to DSA and roadmap, and ECOM aneurysm coiling was done in 2001. Third National Registry meet was conducted in CIMS. This was a significant milestone as all stalwarts of IR were there in Nagpur. We took this occasion to make public awareness and publish advertisement in local newspaper about embolization and revascularization procedure. 2003 saw 2 more cath labs coming to Nagpur. And this was a significant case. A young woman presented with flash pulmonary edema and hypertensive crisis and found to have solitary ectopic right kidney with high-grade renal artery stenosis and aneurysmal dilatation and with a fistula into renal vein. She was successfully treated with balloon expandable stent graft, marking a remarkable regional milestone. Wokad Hospital, a corporate setup, came into Nagpur, and that changed the awareness part of IR in medical community as well as in general population. Radirecognizer chart was created, which included problem, presentation, etiology, and procedure. And I think I am thankful to Vimal when he was in Bombay Hospital. That time he had created some booklet. On that line, I created this radirecognizer chart. Even brochures for general public awareness, they were published and distributed. I was keeping my vascular system up to date by going for walks, trekking in Himalayas and visiting places with family. Beginning 2002, with intracranial, arterial and intravenous thrombolysis, first using urokinase lateral actylase and progressing to mechanical thrombectomy, Nagpur emerged as an aggressive IR center contribution of Sachin Domne along with Dr. Atul Revatkar and Rajesh Mundra. A major academic milestone was establishment of DM program at Datta Mege Institute of Medical Sciences. I served as a TFAC core domain expert from 2007 to 2012, and under Dr. Pankaj Banode, the department expanded with fellowship and DM program. This academic momentum soon spread, with GMC also starting DM program under Dr. Jawahar Rathod's leadership. Meanwhile, I conducted a unique CME on the occasion of Silver Jubilee of CIMS, wherein a clinical problem was presented by a diagnostic radiologist, discussed by a panel of clinicians, and moderated by interventional radiologists. It was a huge success. All goats of IR were there in Nagpur. First transradial carotid stenting was done in February 2010. In the same year, first hybrid Cath-Lab with installation in 2010, and Nagpur has arrived at global level. All complex aortic and visceral procedures were performed in this lab. Hybrid procedures were done routinely here, and you know this duo, the first IR entrepreneur duo of India with successful own setup. Now they will be shifting to a new setup, bigger new setup. In 2014, India honored Sachin Tendulkar with Bharat Ratna, recognizing a lifetime of excellence. In a fitting professional parallel at the 16th annual conference in Mumbai, the same year, I was awarded the prestigious Legion of Interventional Radiology honor. Article to this effect came in Times of India. 5 stalwarts from Nagpur School of IR now serve as global brand ambassadors to the region, each leading a distinct subspecialty. Together, they exemplify the clinical excellence, academic rigor, and global reach of Nagpur IR. 2 major events were conducted in Nagpur: 18th ISVIR Registry cum Complication Meet in 2016, and update on venous diseases in November 2018. Beautiful setup of Cath-Lab was installed at Viveka Hospital. Did 2 contour device placement, one in unruptured ICA top and another ruptured MC aneurysm on single day. Public awareness through newspaper articles continued. I was humbled to receive Lifetime Achievement Award by Vidarbha chapter of Maharashtra State Radiology Association. Tradition of excellence continues in my family. My elder daughter Neha and her husband Aniket, school-time companions, now serve Canadian healthcare. Neha is a dental surgeon and Aniket as a hematologist at Princess Margaret Cancer Center, Toronto. Similarly, my younger daughter Isha, an interventional radiologist, and her childhood friend and husband Pratik, a hemato-oncologist, both GMC Nagpur graduates, are pursuing their career together at Brown University, Rhode Island. Father-daughter duo attended SIR 2022 at Boston. While professional and academic achievements are often the focus of a presentation, none of this would have been possible without the person standing by my side. These photos of Rupal and me represent the heart of our family story. Rupal, you are the innovation in my life and collaboration that made our family that it is today. Here is to many more new years together. Thank you, ISVIR, for the honor. Thank you, my colleagues, and most importantly, thank you to the patients of Central India whose faith and trust fueled this incredible journey. Thank you so much. Thank you.
Thank you so very much, sir. Thank you for sharing this incredible journey, and we'd like to honor you with a medal as a memory of this wonderful moment right here at ISVIR 2026. Thank you so very much. Ma'am, if you want, you would also join us on the stage. Ma'am, if you're here, 2026, join us in this celebration, ma'am. Can we come to the center of the stage? Many congratulations. Thank you so very much. Dr. Shrikaant, you've been incredible. Thank you for all that you did. And thank you for creating. Rupal ma'am, please join us on the stage. We'd love to hear. Ladies and gentlemen, the reason why we succeed is family. It's simply that. Give it up for the wonderful Rupal ma'am. Ladies and gentlemen, nice big round of applause. Yes.
Good evening, everybody. May this new year find you hale and hearty. Thank you for giving me the opportunity to speak. I anticipated that someone will tell me, that's why I have written this. Would like to talk about my husband, Dr. Shrikant, and how the city like Nagpur and he grew together as far as IR is concerned. I have witnessed Shrikant's journey from the time interventional radiology was still in its nascent stage. IR embraced him wholeheartedly, and Shrikant, with equal courage and conviction, chose to walk alongside it. In the early 80s, many interventional radiologists were working within institutes or as a part of teams across India. What was truly heartening was to see him grow richer in experience and wisdom with each passing day and year, often working alone, facing challenges head-on as if guided constantly by some divine force. Even during his recent illness, his zeal and zest kept him going, always holding his chin up. In the early days of his illness, I was deeply touched by the way he handled a particularly complex case, keeping his own anxiety at bay and ensuring that the patient's children who had traveled from abroad were not disappointed. Life can be harsh at times and can leave you confused. But if you are determined to maintain a positive frame of mind, you work on it, you make the journey easier, not just for yourself, but for everyone around you. Thank you very much.
I think in the presentation that Doctor made, thank you, Rupal ma'am, that was incredible. Thank you for sharing the warmth and love on the stage. Many times we don't realize, we the civilians don't understand the struggles, the dark moments that all of you go through, and that chapter she very beautifully brought out. Give her a nice big round of applause. Thank you so much, Rupal ma'am.